We're also joined by Helton, who's a business owner locally and a former elected official. Come on up, everybody. Please welcome Marc.
In this county for years, I always grappled with providing health care for my employees. I was always at a disadvantage with the large companies. I was at a disadvantage more than just price. I was at a disadvantage because we didn't have portability. That health care coverage wasn't able to be transferred from one employer to another because it would be a health care plan that was tailored for whatever package that we had at the moment. We have catastrophic problems in this country with pre-existing conditions. Anyone that has a pre-existing condition that goes to work for a small company or a large company today is excluded from coverage, or it becomes a catastrophic part of that cost. Another issue that is particularly harmful for all of us is the fact that once they find you have a problem, they try to excise you from the process. We no longer, as a nation, can afford that kind of level of care and treatment of our neighbors. It's got to change. The insurance companies have too much control with dollars, not only in their profits, but in their ability to purchase lobbyists and contributions of our elected officials. We all ought to be mad about that. We ought to stand up and fight that process. And we've got some weak-kneed Democrats over there, and we ought to point them out, and they need to stand up and be counted on this. We need health care for all in this country. Thank you.
Yeah. A few short years ago in 2005, we had a president opposed to health care, we had a Congress opposed to health care, we had a governor of Maryland opposed to health care. Then we had two wonderful elections in 2006 and 2008, and all that changed. And what's happened since? Let's talk about the progress we've already made. Soon after taking office, President Obama signed into law an expansion of health care for 4 million children who didn't have it, which his predecessor vetoed twice. 4 million new children got health care. He funded it by increasing the cigarette tax, which is dramatically reducing smoking. Significant progress. Then President Obama signed into law the FDA regulation of tobacco legislation, which his predecessor opposed, over the objections of tobacco companies, which is increasing public health. And he expanded health care through the stimulus package, which is putting much money into Medicaid. There's a lot more to do, but we've already done a lot. Here in Maryland, under Governor O'Malley, Maryland has gone from, believe it or not, 44th in the country to 16th in health care. 44th to 16th. Yeah. I want to thank Delegate Riley and his committee, which got that bill unanimously through, which has provided health care to 55,000 uninsured Marylanders. 55,000. And I want to tell you the story of one of them. A woman named Crystal Moon in Western Maryland. We did a press conference out there with Republican legislators who supported that measure. Remember Delegate Bites on your committee supported it?
Love it.
It was unanimous. And we were there with Democrats and Republicans. Crystal Moon went to get signed up for health care for her children. She knew there was children's health care, and they told her there's this new law that applies to you too. She signed up for it, and she went to her doctor because she could go now, and the doctor said, Ms. Moon, thank God you came, because you were developing a serious problem that would have killed you. And she said at her press conference to all of us, the Delegate Beitzel, thank you for saving my life. Delegate Riley, that goes for you too. She's saying it to you. And to everybody here, because everybody worked on this, we made tremendous progress in expanding health care to 55,000 uninsured people, and we've shown in Maryland that it can happen. You know, Dr. Martin Luther King Jr. told us very rightly that of all the forms of inequality, injustice in health care is the most shocking and inhumane. And what Dr. King would say to us right now is, good work on what you've done so far, but finish the job. And we're going to do that. Thank you very much. DeMarco factory.
We are going to get this job done. We're sending the message, and they are sending the message. And we're joined by Bill West, Ivanka Kolchiski, Georgianne Kohler, Antoinette Krause, Athena Ford, and Dave Neinhauser. And let's hear it for them, for their fortitude in marching all the way from Pennsylvania down to D.C. to send the message. And it couldn't be more timely given what's happening in D.C. next week. So a couple of them are going to speak and tell us about what they're doing and why they're doing it. So Bill, come on up. Bill's going to talk to us first. Welcome, Bill West.
Jim George.
Oh yeah? Can you hear me? Okay, how's that? Good. This is day 4. I've actually lost track of the number of miles we've walked. The total we're doing is 135. We're not quite sure what day of the week it is. Today I was walking down this beautiful highway thinking of the Wizard of Oz. And you know, here we are in the yellow brick road, and we're on our way down to the Emerald City to see a magician and see if we can't get something done. You'll see we've got a bunch of Dorothys. A couple of them are going to talk. I'm the Tin Man. I'm so stiff I can barely walk at this point. But I'm going to get my oil can out, so it'll be okay. We're really short of Toto, so if anybody wants to loan us a dog for the okay. Why am I walking? Well, I'm walking first of all because my wife told me I had to, but I wanted to come anyway. It's an issue that we really care about. We worked on the Obama campaign because we thought he was a good man, but also because we really believe in healthcare reform, and we've kept at it. We have 2 children who are grown. They both live in New York. We're particularly concerned about my son. He's got a very good job. He's a public defender. But you know, they're cutting the budgets for the public defender's offices. He has a chronic condition, you know, which is controlled, but he needs to have health care. And if he loses his job, he has a pre-existing condition, he's not going to have any health insurance. And my wife says that you know, his medical condition is not what keeps her up at night worrying. It's his health insurance. And that's just ridiculous. The other thing I want to say, the last thing is, you know, a lot of people, and people have alluded to this already, but a lot of people think this is somebody else's problem. They think it's the problem of the uninsured, or, you know, people lose their jobs. Well, you know, that's too bad, but I'm not going to lose my job, so it's okay. Well, I want to tell you folks, and I think you'll all agree with me, we're all that close away from not having health care. This is everybody's problem in this country. We've got to come together. We've got to solve it. And I think we should do that public option. Don't you?
Yeah! Let's hear it for Bill.
Marc Stier, I'm the State Director of Healthcare for America now in Pennsylvania. And I just want to thank you to all of you, and especially thank you to Matthew Weinstein. When we came up with this idea of marching, you know, everyone said, first of all, you're nuts. Second of all, they said, wait till July, and I said, it better be over by July. And then third, they say, well, what are you going to do through Delaware and Maryland? I said, we're going to do events. I said, how are you going to do events? I said, well, I think the good people of Maryland and the HCAN folks in Maryland are going to help us out. And they said, have you asked them yet? I said, nope. But, you know, I have a feeling about the kind of people doing this work and the kind of activists we have all across the country, because I'm sure you are no different than all the great people we have in Pennsylvania. So I want to thank you all for coming. Thanks for this reception. It's great for the marchers to see you all here. It's great for this movement for all of us to be here today. I want to thank Matthew for organizing it. And if you're not doing anything on Wednesday the 24th, we're having a big event in Washington. We're expecting hundreds and hundreds of people to be with us on the last mile. Come to Union Station at 12:30 p.m. And then on the 9th, we're doing another event in Washington. So come to one of those or come to both of them. Thanks very much.
And I just want to say about these events, like Marc said, they're coming down to Washington, and we're going to have we have at least 500 people coming to that final event. We're going to have some senators and House members there on Wednesday, but the event on March 9th is going to be